Hi there. It is our honor to welcome you to our session titled TCNJ's Collaborative Approach to Support Health and Wellness. I am Laura Bruno, and with me is Dr. Ann Farrell. Hello, Ann. We are faculty here in the Department of Kinesiology and Health Sciences, and Ann is also faculty in the Department of Public Health as well. I guess before I move, I'll share just a little bit of background about us. Both Ann and I come to TCNJ with backgrounds in health education, physical education, as well as community health. And as I mentioned, is faculty between both departments. I'm currently with the Department of Kinesiology and Health Sciences, and I handle some of the courses for students who are enrolled in the Health and Wellness minor. I'm also working on creating a path for students who are interested in being health coaches. That's also an area of interest for me, and I'm currently a nationally board certified health and wellness coach and has both degrees in physical education, health physical education, as well as a master's of public health. Anything I missed and you want to add there, Dr. Farrell?
We're good.
Okay. All right, so we are so thrilled to be able to talk a little bit about what our campus has done to identify and address some of the health concerns and push some healthy initiatives within the TCNJ campus. So what we'll share with you today is about our collaborative efforts, and we'll identify how we have really worked to collaborate with departments and resources across campus to provide opportunities and experiences for our students, faculty, staff, as well as, to an extent, the larger community campus and even beyond the college campus and into the community itself. So within the School of Nursing and Health Science, one of the things is we do seek a systemic approach to positively impact the health and well-being of all students, all faculty, all staff, and all community members. This has been something that's really been front and center and something that's been important to not only our department and our school, but our dean, and even at the higher levels, some of our academic leaders as well. Ann's going to share a little bit about the history and the connection with building healthy academic communities.
So roughly about 7-8 years ago, the School of Nursing, Health, and Exercise Science became actively involved with becoming a founding member of the National Consortium of Building Healthy Academic Communities. The acronym is BHAC. And why we were interested in becoming a part of this is because at the time, TCNJ had unfortunately been given the identification as a survivors campus. We had, in a very short period of time, multiple student suicides, as well as a couple of faculty suicides. And the campus, in fact, really, although, condolences were provided, they did not respond particularly well. So as part of a founding member, it was really thinking about how can we participate or how can we help build an organization that demonstrates a high level of commitment to the health and well-being of all campus community members. So it was about exploring and presenting best practices and ways of engaging people on campus in new ways. At least for our campus, it would be a new way. So, the general things, wellness expos, mindfulness activities, stress management classes, all of the things that go along with that kind of wellness initiative. But what we have found has worked is that, or at least got us originally spurred on, was that there were national events and challenges. So I would encourage you, if you're not familiar with BHAC, to take a gander at their website and see what they can do for you. After we became involved in BHAC, again, we were part of one of these national wellness challenges. In fact, we were part of a month-long self-chosen breathe in, breathe out mindfulness challenge. And that proved to be wildly successful across campus. Everybody got involved, students, staff, faculty. It was so well received. Obviously, it advocated and promoted health and well-being throughout the community. It supported kind of the needs and direction we wanted to do based on being a survivors campus. It aligned directly with what SAMHSA, which is the Substance Abuse and Mental Health Services, said we should be doing. And again, we had additional buy-in from the college. Right at that time, the timing happened to be good. Not only were we a survivors campus, but we got NESE data back. And NESE is the National Survey of Student Engagement, if you don't know. It's a self-reported document on health behaviors by the students. And what we got back was that TCNJ students reported anywhere from 11 to 15% higher self-reported rates for anxiety and depression than the national average. And additionally, there were higher rates of riskier behaviors for females on campus. So between SAMHSA information, our survivor status, the NESE data, you know, there was strong support for things needed to change on campus. So TCNJ administration took notice about the needs and the interest. And so they actually pushed for a systematic body to review designs and advocate to achieve like how we're going to move towards a healthy culture. And it was great because they actually said, all right, not only are we just going to take charge, who's going to do, what are they going to do? Who needs to do it? Who needs to be involved? And the first thing is that they actually said, hey, listen, we have a strategic plan change. It's middle states. And so we need to kind of redo this and put health and wellness at the center. And so their priority one was to attract and retain talented students, faculty, staff, all of those things. But how do we do that if we can't support the holistic health and wellness of them? And so as a subset, one of the priorities, again, building a robust intellectual community, what they added here was a critical piece, which it wasn't just to support the programmatic needs of students and professionals, but to look at not just the professional learning, but the personal learning to make it a much more holistic approach. So for our particular department, we were really fortunate, and this was kind of like the one and only time that we didn't feel like an ugly stepchild, right? That faculty within our department, particularly Laura and I to start, were asked to really be part of this initiative and strategic planning about how we were going to move forward. As Laura said earlier, we have a strong background in health education. She's a trained health coach, has a strong background in community wellness. Again, I'm a health and PE teacher. I have certifications in mindfulness and meditation. Again, I have a background in public health. So we had a lot to pull from. More importantly, though, while we were asked, is that across campus, they knew that we had extensive experience with incorporating the dimensions of wellness into our academic, our community, and our research settings. So again, the primary reason why we were asked to help spearhead this campus-wide effort. However, it was at this time that while we shared the dimensions of wellness, and we said that this is a great starting point, we were really interested in using another approach to push this movement forward. And Laura's going to discuss the longevity health wheel next and how we use that as a guide.
Yeah, and so just to kind of spotlight, I think Anne and I both really subscribe to the importance of understanding the dimensions of wellness. It's hard to debate anything around that. And, we find this incredibly helpful and pivotal when we're working with students sort of in the academic setting and encouraging them to explore their own dimensions of wellness and identify strategies and techniques and ways that they can really target and improve each of these dimensions so that they find a sense of balance and ultimately improve their level of health and well-being. So we not only encourage them to look at the dimensions on that personal level. In our classes, we embedded and we talk about these dimensions sort of in a communal level, and we even take it as far to look at the global levels of wellness and identify how, from a global perspective, these dimensions of wellness can vary across geographical areas. So we are doing a lot with these dimensions. When we were charged with understanding and supporting a collaborative effort across campus, one thing that we found to kind of align, I think, a little bit more clearly was this longevity health wheel. If you're not familiar with this concept, I have to give all credit to Dan Buettner here. He's an explorer, he's a National Geographic Fellow. He's an educator, an author, public speaker, and basically through his travels and research, he has discovered the 5 places in the world, which he dubs the blue zones. And it is in these areas where people are recorded to live the longest and healthiest lives. So through his research and his findings, he focuses on changes at the local environment, right? So we can think of that similar to a college campus. He focuses on changes to public policy. So through our lens, we can kind of think of that in regards to our college strategic plan. He also looks at changes at social networks. And so again, aligning with a college, that would be similar to organizations, different departments across campus within the college community. And so through our work as a college campus, we have found that faculty and academic leaders really have taken to this model. They find it relatable, they can make those connections. And I think it provides just a little bit more of a more tangible understanding of exactly what it is we're trying to do. So you'll see here the longevity wheel, it actually identifies 4 key domains, and that includes movement, nutrition, connections, and outlook. Okay, and each of these principles are equally important. I think the visual here is that each domain is kind of color coded, but you'll see that similar to the wellness wheel, the dimensions of wellness, not any one of these things, or I should say, not one of these things is any more important than any other. So they're all equally important. And again, it's about kind of finding that balance. And so there are various elements within each one of these domains that connect or support the principle for which he's identified. So I'm going to lead us off and just kind of talk a little bit about the first one, which is move naturally. I think too often when we think about movement, and maybe it has to do more with just kind of where we are as a society, we oftentimes think that movement must be intentional, right? So it's exercise. Oftentimes there's not pleasure connected or associated with that. And it's this idea that it has to be something we do intentionally. We carve time out of our day to go to the gym, take a yoga class, go for a run, right? Insert any physical activity in there that you would like. But the finding from this research was really that the greatest benefit when it came to movement, obviously this was a key finding, but it was natural movement, right? So this idea that movement is simply fluid or an organic part of your daily activities. So those individuals truly who are leading the healthiest, longest lives, they're moving naturally. It's part of everything that they do. It's embodied in every aspect of their life. And so that's a pretty important element there. This idea is very conducive to a college campus because there's natural movement opportunities in a more organic type way. That differs than like a traditional 9-to-5 workday where you're expected to sit at a computer, you're expected to work these set hours and you have a break during this time. A college campus, it allows, I think, for a little bit more of that organic movement that we're talking about here. Often on a college campus, there's a lot of walking and biking. You have students who are biking to and from their classes. Maybe they're walking to go meet others at a social event. They're engaged in physical activities like tossing a frisbee or a football within the quad. So we know that the physical activity is happening, but really the question of can we do more as a college to encourage and to support others in this fashion is really front and center. And we know that based on the current health of the population, when we look at trends, across the globe, but especially here in the States, the answer to that is yes, we need to be doing more, we should be doing more, and let's do more. So through the collaborative approach, TCNJ has worked to prioritize movement on campus. Despite Ann and I's best efforts, and we will continue to fight this good fight, but one of the things that we were really trying to encourage was a change to what we call our college core or our liberal learning courses. And we really feel like it's important that a movement-based course is an element that's required of all students, just so they can really learn those healthy habits so that they can foster a love and appreciation for some type of movement, right? And that can look different for different students, but exposing them and giving them that opportunity and that experience. So like I said, we've not yet won that fight, but we will continue to do that because that's so important and such a strong value that we have in knowing that the benefit that that can provide. So didn't happen quite yet, but there are things that we both do in our classes. So as we're working with students, we are bringing that movement into our classes. So we're providing brain breaks, activities, movement breaks, even things just small enough to kind of get students back up, engaged, to make sure that they're actively involved in our courses. There is a plethora of information and research that connects movement to academic success, as well as information retention. So on a personal level, within our professional realm, that's something that we take a very proactive approach when it comes to our own course design, just to make sure that we are, encouraging that movement in our courses as well. Additionally, through the efforts of student affairs, student government, construction services, as well as the Department of Kinesiology and Health Sciences, we were able to receive a grant through the National Fitness Campaign. We were the first college in New Jersey to acquire that. So I'm going to go ahead and give us a little cha-cha for that. But what we were able to do was really create and fund this outdoor fitness space. And so this provides an opportunity for the whole community. So yes, our students can use it. Yes, our faculty, our staff, but also the town, right? So we are an open campus, and individuals from the town, the larger community, they are welcome to come on campus and use some of these facilities. And this is one example of that. So there's a small picture at the bottom here, but basically, for this fitness space, there's QR codes. So even a person who's maybe new to the idea of exercise or working out, or is unsure of the form for some of these different activities, they have that opportunity to actually engage and be able to look it up and learn about that. So we're really excited to bring that to the campus, and that was truly a collaborative effort. So a collaboration of time, of finances, of planning, all those different pieces came together, and that resulted in something really wonderful for our college campus. Similar to this, another key collaborative effort was the fitness path. And so this effort really simply began as a means to identify, hey, we need to provide folks with a safe and accessible area where they can move naturally. So the fitness path was created, and some updates were made to make sure it was safe and accessible to everyone. If anytime that you drive through campus, you're going to find dozens and dozens of people who are just either walking on it. Sometimes faculty and staff go out and they take their lunch. They're out there moving. Students are jogging on it. So it really is, an easy concept and something that is very heavily utilized within the college campus. The college also worked to promote physical activity through various initiatives. And so I've kind of highlighted just a few here. There certainly are many more than this, but a couple things that just kind of jump out is some of these initiatives, like a Walking Wednesday. The college really encourages students to connect with students, or students to go out with faculty and just not only be moving, but also be working on that interpersonal piece as well, where those connections can happen. And if you recall, connection was a piece of this longevity health wheel. So anytime that there's things that are going to kind of go across these domains, that's really helpful and really beneficial. So Walking Wednesdays were encouraged to promote physical activity, as well as encourage those connections to happen between individuals. Academic leaders were also encouraged and given some training and some suggestion that when conflict arises, which we know it will always be there at different times, to actually adopt and try out what they term a conflict resolution walk. And so a couple things there. A, it's movement. So we know that as we are moving, we're releasing endorphins. So there's lots of positivity around moving. The second piece is when you're walking, you're moving forward. So if you're engaging in conversation or if you're addressing maybe a heavy topic, you know, it's more about how can we get past this? How can we improve upon this? And so that conflict resolution piece is really intended to encourage support and also promote a sense of belonging, right? So as I'm talking with this person, we're moving forward, we're engaging in physical activity, I'm feeling supported, and I'm also feeling a sense of belonging within this college community. The Department of Recreation also partnered with some various departments across campus to bring just more additional movement events and activities. So the Recreate Night, there's a couple pictures here. This is one example that was designed to provide fun, interactive activities that are going to support movement and healthy living, provides opportunities that are focused on healthy choices. So if a student is in a position and it's Friday night and they're not wanting to go out and, you know, party or do any of those risky behaviors, they have some options. And so, you know, the rec center recognized how can we engage students in ways that are fun, kind of talk their talk, provide opportunities that they're going to respond to and that they're going to enjoy, while also keeping kind of at front and center there that idea of how can we promote health and wellness. So how can we encourage them to be active during this time? What activities would they like? And let's be honest, who doesn't want to throw on a plastic ball and roll around? I mean, sign me up. So that was one example of, and that's the Recreate the Night. The college also, the Department of the Dean of Students Office, pardon me, also sort of created this Move 365 initiative. And within this, the idea is 365 days a year, there's some type of activity, physical activity that students can do or that can be provided to them. So it's about recognizing the important role that consistency plays in that. And so helping students recognize that, yes, you can move naturally, and you can move every day of the year. And so it really kind of supports and just, again, encourages that healthy movement. All right, so that is kind of an idea of really what's happening as far as the movement base. There are many other things that I feel like our college has done, and I think we have some really great folks across campus who do value that, and there's other things I could talk probably the whole duration of this about other things that we've done, but that just sort of spotlights a few things in regards to the putting movement first. So kind of going hand in hand with movement, the other piece often of physical health, you've got the physical activity, and then you also have that nutritional piece, and they do often go hand in hand. So this again was something that our college took a real strong look at and thought, what are we doing and how can we do it better? And so one of the things was a collaborative effort across campus, and that was to feature healthy eating. So truly at the most basic level, to address food insecurity, we know that we have people both on campus, we know that we have folks in the community who are struggling or who don't have access or the funds to be able to attain appropriate and healthy food choices. So the Departments of Public Health, the Department of Sociology, and Student Affairs all came together collaboratively and created a food pantry. And this is accessible to members of the college and members just within the greater community. So this is really there for anyone who could possibly need it. And you can see here just an example, free produce. So it really is working on how can we provide healthy eating options. That's one thing that we see often with food insecure areas is there could potentially be some food, but what food are we providing? Are we providing real, you know, good, healthy food that's going to fuel their body and provide essential vitamins and minerals? Or is it just, here's, you know, some crackers, that type of thing? And so we know the importance of making sure we're providing whole foods in order so that everyone is getting the appropriate nutrients. Our primary food provider is Sodexo. It's the company who really services all of our food. And this was one area where they took a really strong proactive approach, which I'm proud to say that that happened on campus. Sodexo really has made some changes over the past couple years. They started where we all should. They sort of polled the community to identify what are areas that we could improve upon and what are some things that maybe we're doing great or you think, you'd like us to explore more, we could do better. So they started there really with a survey just to identify what those needs and wants of the college campus community are. And then from there, they listened. So they've taken strides to be mindful of dietary concerns. So within our food services, there's lots more healthy options. I feel like oftentimes college campuses have a bad rap. You go into the cafeteria and it's just fried food. Here's fried chicken, here's fried, French fries. And so I think that's one thing that we're really seeing across all campuses, but for a fact, I know TCNJ has made it a priority to provide those healthier options to everyone. They also have QR codes for all of the food that's available, and that's helpful for folks that maybe have food allergies. So within that QR code, someone can scan that, and they can see the ingredients that are part of that particular food. They can see the caloric value and all those different important nutritional pieces as well. Additionally, the college took a nice look at their snack options, right? If a student's running between classes, they don't have an opportunity to get and have a full meal, what snack options are available to them to help them make these healthy choices where they're eating wisely. And so the college added some healthy options to the vending machines, which ultimately is improving those folks who maybe need to take advantage of the snack options. They now have healthier options as opposed to just a Milky Way, right? Or a Coke coming out of the vending machine. And the college has worked really hard to update within the college buildings across the campus with refillable water stations. So this is helping to limit our carbon footprint as well as promote the all-important hydration, right? We know that that's equally important. Staying hydrated is going to help with a plethora of things as far as your health as well. So those are just a few things that we've seen sort of on campus here. Also across the board, different departments have really been provided opportunities. They've been challenged to think about, hey, let's take this collaboration thing even further and let's think about how we can look to departments and add some creativity. How can you kind of spice up a nutritional program based on your area of expertise? And so I provided two different examples here. This is the Department of Kinesiology and Health Sciences. So we are very much, sort of around this idea of mind, body, soul emphasis. And so the program that we came up with was nourishment for the mind, body, and soul. And so we were able to kind of create or cultivate this menu that supported this theme or this idea. The other example I provided here for you was one from the School of Education, Environmental Studies. And you can see they focused on saving the planet one bite at a time. So this was just sort of a fun challenge where it was collaborative and it allowed all of the departments to get creative. And even though we had, engineering and all these different departments that maybe don't necessarily connect with healthy eating, they were able to provide a level of encouragement and creativity around how can we eat wisely. The last two pieces of the wheel here within the Eat Wisely context is we talked a little bit about plant-based, so that aligns with the eating. But the last two pieces are wine and moderation. And they actually go hand in hand here. So the findings from Dan Buettner's research, along with the longevity wheel, found that in each of the blue zones, there were a high number, the highest number reported of centurions, wine in moderation was a commonality. So we know that alcohol use on college campuses is prevalent. And it's noted that 80% of college students consume alcohol to some degree, with the most recent statistics noting that 27.4% of college students report binge drinking in the past month. And that's really important because having a glass of wine is different than having a bottle of wine. So that binge drinking part really is pivotal. And that's something that is important that we're addressing and supporting here at the college level in particular. 7.3% of those polled indicate heavy alcohol use. So we know that on college campus, we know it's prevalent, we know it's happening. And the sad reality is that it's happening at higher levels than we would necessarily, want to see that. And what I find to be interesting too, if you look at the gender difference of the number that I mentioned before, that 27.4%, 25% of males are the ones that are indicating heavy drinking in the past month, and it's 30% females. So there's some gender differences there as well, which is important information for us to know so that we can move forward in an appropriate manner and help provide education, support, and activities around that so that we can work to improve the health and wellness as well. So what did we do? Well, just like every college, TCNJ is not unique and is, not faced with similar concerns with that. So what we did is we responded with increased alcohol and drug prevention services to promote moderation, okay? So the Department of Counseling and Psychology brought awareness and education programs to the campus. There were targeted efforts that really focused on binge drinking in particular. So looking at, what can we do? What are the risks associated with this? What are some healthy alternatives perhaps that we can do? And so it was awareness and it was also education. And as I mentioned, the targeted efforts, they also focused on specific subgroups or subpopulations within the campus community. So there was a lot of information about, pushing moderation, understanding the negative implications of binge drinking. And two areas that were really targeted were student athletes who surprisingly had very high levels of, very high reports of binge drinking, and also those who are involved in Greek life. So it's not to say there was not education programs provided elsewhere. Truly, this was kind of throughout the campus community, but these were two that I'd say heavy hitters that they really wanted to work on and help students understand. And like I said, not just educate, but also provide healthy alternatives. What is moderation? What does moderation look like? And how can we move forward in a way where we are encouraging moderation when it comes to that? All right, so basically, I hope I've kind of illustrated that, TCNJ efforts across campus, both on and off campus, TCNJ has really worked hard to improve not only the nutrition, but also the physical activity. So kind of our intake and our export as far as of calories and exercise. And so I'm going to invite Anne to discuss the final two domains, which include Connect and Outlook. Take it away, Anne.
Thank you, Laura. So yes, the third dimension is Connect. And you can see with Connect, the sub-elements is that there's a need to put family first. There's a need to find good partnerships / relationships, as well as taking that a step further to finding your right tribe, right? Where are the interpersonal connections that are supportive in nature? At TCNJ, as we were looking at this and we were saying, oh, family first, we shouldn't really touch that. But the reality is that TCNJ was already doing a pretty good job with having family events. We have, just like other schools, parents' weekends, but there's also parents' luncheons, particularly those, they noticed that they were favoring those who were alumni and said, hey, let's expand that, right? So there were alumni and let's expand it to other families. And so they started putting together those kind of ice cream socials that we have for faculty and staff. So doing family fun outings that were much smaller in focus, but still available. And so we did see more students or more families coming to campus. And it was a nice way for them to connect with their students and see what some of the cool things that we were attempting to do on campus. Outside of the family, things that were already in place at TCNJ that were known actually nationally, we actually doubled down on at that point. One of the things is that we have some wonderful first year experiences, and I'm going to talk about them in a couple of different ways. The first thing comes out of in that first year experience, well, most students want to have nothing to do with summer reading before they even get to college. Our liberal learning office oversees this summer reading program that has students engaged early. It's kind of an easy lead in to the college. It gets faculty, students, and peers working together, kind of thinking about, hey, you know, educationally, we're going to challenge you to think outside the box. And so we do that through this kind of book series, this book reading. And students seem to kind of come into campus then already, you know, in a position of, listen, I've already met with some students, I've talked to them, that's great. And there's less fear of speaking when you get to class. Additionally, what we're really proud of is that we had cohort-based learning experiences during that first year experience. It's based around a community-engaged learning experience that students say, yeah, this is something that I would like to be interested in. And we find groups that like the same things. They would live on the same floor together in the residence halls, and then they would be assigned to a particular class together. And so it gave them kind of like, let's go out to the community, let's explore what they're doing in the community. What did I like? What didn't I like? How is this a valuable experience? And it kind of sets the stage where they're already building relationships and friends and experiences very early on in their career. When they're living there, right, residential education also plays a part where they're giving them kind of an update on, hey, here are some life skills, because believe it or not, some students don't know how to communicate with each other. They don't know how to use a washing machine. They don't know how to share. So it also helps build relationships that way. So in this particular collaboration, we see this strong relationship between residential housing and academics, where they're looking to build this strong community early on. Additionally, TCNJ is known for its teacher-scholar model. And so what we base our teacher-scholar model is that TCNJ is primarily a residential undergraduate institution. We don't have that many graduate programs. And this teacher-scholar model says, hey, look, early and often, we want faculty to get the students engaged professionally. Do they help you with your research? Do they help do literature reviews? Do they do so much that they get to co-present with you? Do they present with you? Do they write articles with you? Right? So there's a variety of different things that they can do, but early and often is what we say with regards to the teacher-scholar model. Get the students engaged early and often on a professional level so that they know that what they're learning and what they can contribute are of value, right? By the time our students graduate, almost every student, and I'm talking about the kinesiology and health exercise science students, that all of our students have presented somewhere, and they feel valued, and they are not afraid then to continue to be engaged in the profession. And we're really proud of that. Within the first semester classes, there's an 099 class. It's required for all incoming students and transfer students. It's a 0 credit course. Usually it's, you know, you might only meet 6 or 7 times throughout the year, but there are really important features that are, and content that are discussed there, and we ask students to implement. First thing, time management. You know, students get to college and some of them go a little bonkers. They don't know how not to use every hour of a day because they're used to being in high school from, you know, 7:40 in the morning till 2:25, and then they go to practice, and then they go eat dinner, and then they do their homework, and then they go to bed, right? With social media sprinkled in between, right? But the reality is they get here and they find these blocks of time, and they end up getting behind because then, you know, the important stuff goes away. So we teach them how to do that, or we encourage them to put some of the strategies that we're presenting to them in place. And one of those is, hey, you're all in the same major when you're in this 099. You're probably in a lot of similar classes with people. How about you find people that have similar schedules with you so that you can study together, hang out together, whatever, go to dinner together, whatever it might be. On top of that, it's, hey, let's evaluate your study habits, because what worked in high school may not work here. And so once again, we say, here's the tutoring center. You have this new group of friends / colleagues, peers that you are meeting with. How about you figure out what works for all of you, share. And so then again, they also tend to lean on each other a little bit more when it comes to let me learn new study habits and actually let me study. And also within this first year seminar class, we do, in conjunction with the way the residence halls do it, is talk about effective communication. Students come in oftentimes and they're a little too informal, or they're too formal or a little too informal. And so we talk about effective communication, both with your peers, with the faculty, with the staff, just to get them ready to be part of that teacher-scholar model earlier than what most students in other campuses do. The key thing here with the 099 that we found to have the biggest impact is that one of the things, or actually a couple of things that we asked them to do, is check what's happening on campus and professionally. So we want them to do some sort of exploration about what's available to them, and then find out what's most of interest to them. And then you have to be part of something. Try it out, see if it's for you, see if you can find your people. And that leads to that find your right tribe. These are the emotional support people that you're going to find in your group. These are going to be your friends. This is going to be your clique that's going to help see you through both academic and social issues that come, that will arise in college. So adopting these requirements gave, our institution similar results that was found in previous research, that academic success comes from good time management, being part of a group, and developing good study habits. But the strongest indicator of retention and academic success is the connectedness piece. So we feel we're doing a really good job at that freshman year for students to feel connected and see success. We're in the high 80% range, TCNJ, for 4-year graduation rates, retention rates. We're in the 90% range for retention rates. We're in the high 80% for 4-year graduation rates, mid 90% for 6-year graduation rates. So we know what we're doing right now works because we're helping students find their tribe, their emotional support people. Last thing in this section that we're going to address more in the next section is this idea of goal setting. So with the goal setting, it takes part in this 4th dimension, which is outlook. And outlook refers to being able to unwind and relax, to have faith in something, right? It does not have to be a religious connection, but have faith in something. And most importantly, to find a purpose. What is your purpose? So again, in the 099 course, we do goal setting. And I think what we do well across TCNJ as well is that we're asking students to review their goals, both the goals that they've set for the academic side, for the personal side, and for the professional side. We ask them to review them often. So not just in the 099, but we ask them to do that throughout the program. And we say, okay, so if you didn't meet it, what didn't you do? So we help them re-gear, re-gauge what was successful, what wasn't, and how to help them be more successful. So outside of that, when we talk about this kind of unwind, relax, have faith, we have a spiritual center like most colleges, right? It's non-denominational. But one of the key pieces that is connected with that is that we have this Center for Mindfulness. And there are many, many, many meditative and mindful practices that they put in place that the students can participate in all across. So between the spiritual center, the rec center, there's a lot of opportunities for students to unwind and relax. And as you saw from our high rates of anxiety and depression, they need it. So when all of these things cannot or do not, help them unwind and relax. And we feel like there's high levels of anxiety and stress. Like other campuses, we have our counseling center, counseling and psychological services. Since COVID, we definitely were able to expand these services, but we're really trying to be as proactive as possible so students don't need these services. But we have been reactive in an appropriate way to expand these services because, again, as I said, post-COVID, our stress numbers went through the roof and we needed them. So while we couldn't accommodate them all on campus, we were able to accommodate them by purchasing an outside vendor. And we'll talk about it a little bit later that CAPS is also supported by our Center for Integrative Learning. We continue with Outlook. We've done some other cool things. We used to have a wellness fair, but we upped our ante to say, the wellness fair was good, but it wasn't great. And so we changed it to the Thrive Wellness Expo. We had many more internal and external options and services provided. And all of those options cover just about all the areas, all the dimensions of wellness, as well as all the dimensions of our longevity wheel. Additionally, we were asking just about every program across campus to provide something that impacted someone's health, both on a small and large, in a small or large way. And it was very cool to see some of the things that some of the offices came up with. Additionally, which I very much like, being that I'm a stress management instructor, the TCNJ adopted mental health days. So just like the National Night Out for K-12 schools, TCNJ encouraged faculty to provide days without homework or exams, and there's usually 2 per semester. And so that's outside of whether it's their spring break or their fall break. Students embraced it. They love it. So where we can, we try and give students another day off. So we have something like Mindful Mondays that the college uses the digital platform, which is called Roar, because we are the Lions. And it's so every Monday they get something to help them think about, let's be mindful, let's figure out how to relax, let's see how we can stay positive. So it'll give them samples of positive affirmation statements. It'll give them a breathing technique. It'll say, okay, list 10 things that went right already. So again, it helps them remind that everything isn't terrible, that today's a good day, and to, start the week out on a positive. Additionally, we have things like reading days, which I haven't seen at other institutions. And reading days are 2 extra days between the end of the semester and finals. So students feel like they have an extended period of time to really prepare going into finals. They appreciate it a lot. And we do see the academic success that kind of goes, right alongside with that. Through our program, as well as our health and wellness department, there's peer wellness coaching that's being offered across the campus right now. And it's very cool where we see these peer educators that are being trained on a broad set of skills, and they're able to work with their peers, particularly students who don't necessarily want to work with a trained professional. They feel awkward going to CAPS, or they don't want to talk with a faculty member or a nurse. So having these students where they can just go log online through our CAPS and our care center and say, I'd really like to speak with a peer, they're able to get some peer coaching that helps them deal with whatever's going on. Lastly, and I'm just going to talk a little bit about our Center for Integrative Wellness. This was acquired and created first through the School of Nursing and Health Sciences, and now it's for the entire school and supported through a multi-million-dollar grant over the past couple of years through the Attorney General's office. But one of the things that we have is an MIOK program. And there's nurse practitioners, public health providers, counselors, trained mental health officers, and other coaches that work with individuals on trauma-based care. So we know that students need mental health services sometimes, but the reality is that many times it's not identified where that trauma is coming from or where their issue is coming from. And often we have found that there's some sort of trauma, and we can identify trauma as anything that came from any sort of accident, neglect, true abuse at some point in their life. And so if we're unsure how to deal with these individuals, so that we can work on their mental health and their faith, we send them to the CIW, and then they can get properly screened and directed to the individuals that need their help. So you can see that we're really working hard to try and find ways to help students unwind, have some faith, whether it's in us or a religious or spiritual practice, and then really find purpose for themselves across campus outside of the academic side. Bodies across campus are doing their part. So Laura's going to talk more about some of the cool things that the Center of Integrative Wellness does for our students, faculty, and staff.
Yeah, and to kind of just summarize, I think Anne sort of gave the background of the CIW and how it started and sort of where it has since grown, and the MIOK program is housed within that, and that's certainly something that's really of utmost importance, because that's a totally different skill set when you're dealing with something that is rooted in trauma. And there are trained professionals who have really identified how to approach that and how to best support those individuals. Another great thing with that program is when we look at things like rape and the numbers, oftentimes a lot goes unreported. And so the MIOK program within that umbrella of the CIW is confidential. And so a student, an individual can go there, and that's open not just to our campus, our immediate students, but to the broader community as well. So any person really can contact. There's a 24-hour helpline. So that's really a great resource that focuses on anyone who is dealing with some type of issue that could stem from trauma. But the CIW, again, understands that the concept of health and wellness is really multidimensional. It embodies spirituality, mindfulness, stress management is a key component, providing individuals with resources around nutrition, fitness, stress management. All of that is an integral part to what the Center for Integrative Wellness does. Below there are listed just some of the components and some of the resources that are currently offered, and there are some great opportunities, and this also speaks to the equity level. So if you have an individual, again, maybe not even just who's someone of our campus community, but someone who is out beyond within the community itself, there's opportunities there. So body composition is one of the things, the bone density screening. There are individuals who are trained to provide fitness testing and movement analytics. There's fitness planning, there's massage therapy, there's group counseling, mental health counseling. So there is a plethora of resources available to the community for anyone who might need really anything related to wellness. So it's a great hub, it's a great home to have that as a resource. And again, that is a collaborative effort. That's individuals who are really at the medical level, individuals who are more in the counseling and working in psychology. And so it truly is a collaborative effort to be able to bring that to the campus. So I guess, kind of to close everything and summarize, I hope that what we provided here to you really kind of provided some clarity around the importance of collaboration. Obviously, we are speaking from our experience from a college level, but the reality is whatever organization you're part of, if you are attempting to do something on your own, so if Anne and I, just in the Department of KHS, tried to make these positive changes, we would fall short because we would need the support of, housing, recreation. We need the support of student government. We need facilities and operations. So I think I'm hoping that's the key takeaway, is that there's success when you approach this through an interdisciplinary collaboration model. And so you know, we have really made this a priority. We've worked hard to collaborate and to expand the types of programs, the types of supports, and the resources that can be available to our community, right? So cultural, recreational activities were created to introduce opportunities to be more inclusive and meet unique needs of the community members. There were efforts that targeted the campus community as well as supported the community at large, so even beyond just our campus itself. And there were initiatives to promote movement, right? So going back, move naturally, physical recreational activities. Changes were made from the dietary perspective and nutrition. So how can we improve? How can we educate? How can we support the nutritional needs for all of the people on campus? There were also programs and supports to help build connections. So we took a nice hard look at what can we do to encourage those connections even more. We've embedded it into the academics, we've embedded it into the campus community. And so really there was a strong, heavy focus on how do we let people know they're valued, let people know that they are a part of this, and how do we support them to feel connected through activities, through in-class, through where we're assigning them to live and everything in between. So how do we build connections? And then of course, how can we proactively enhance opportunities to encourage that positive outlook on life, right? So we know that having that sense of purpose, that's pivotal. That's really important to the success of an individual. And so we've done a lot to focus on how can we help students unwind, manage their stress, how can we provide them those opportunities to identify and follow through on that sense of purpose. And it's through these collaborative efforts that we feel TCNJ has really made health and wellness a priority. And we're already seeing some of the pros and the benefits from that. So we're already seeing our students and how they're responding. Anne had mentioned the reading days, the stress levels around that time in particular. So we're definitely moving in the right direction. Is there room for improvement? Absolutely. We can start with a movement-based core class, which we'll still continue to fight for, but there's always going to be room for improvement. And this is going to be an ongoing process because the concerns that we see with health and wellness, they're trends. And so in 5 years, there's going to be another trend that we're going to need to be proactive and anticipate that. And there's going to be some things that we need to change with how we're responding. And so it's an ongoing process, it's a cycle, and our goal is really just to continue to think of it through that collaborative lens, because that's really where the wins are. It's not the win of any one group or any organization or department. It truly is a collaborative effort. So on that note, we hope that you found this information valuable. We hope that you found it helpful. We hope that maybe you are able to walk away from this and start to think about how within your organization, there are things that could be done to identify and improve the areas of health and wellness. So that's our challenge to you as you leave here today. Hopefully you can take a similar collaborative approach to improve the health and well-being of others. We appreciate you joining us and spending time, and be well. Thank you so much.